today's program. So, I don't think much already. So, I just give a brief introduction of why this program has been arranged. So, a year ago, we met the director of the Design Institute of Biomedical Sciences, Whitefield. So, he himself came up with a proposal that every youth should undergo this basic life support course, which can help you save a life. So this is a prerequisite for the course that is being offered at Super Specialty Hospital in association with the American Heart Association. So in this program, basically, they have provided a material which is 94-page material by American Heart Association. So for people of non-medical background, it will be tough to go through everything because the terminologies, the current schedules you have in the daily life. So preparing that is a little bit tedious. That's why to abridge that and to give a gist of it and to be more effective, we have a structured program with a lot of videos and all this stuff. So the team of whether Suryadeep and his friends, they have already undergone this course month of November. So all of them are certified by AHA. So they will be taking over this program and explaining you the steps, gist of the steps. So after this, once you can undergo the course and the Science of Medical Sciences point of view. So I request Suryadeep to introduce his team and before today's course of the program.
Sign up everyone, very good morning. I hope you all are excited for today's session. The first and foremost, of course, our entire team, please kindly come up. On the ladies section, we have Suprita, Shruti and Sagarika. They will be demonstrating, Sagarika has prepared this wonderful presentation that we are going to see. Shruti and Suprita will be also joining us in the team. On the gen side, myself and brother Ankur, who has prepared the handouts that you have received, wonderfully has prepared. So we're going to just start with the session. The entire session is divided into two parts. The first part, it will be from now till 10:15. So we're going to have audio visuals along with the presentations. Then we're going to break for the small evening along with Arati's. Swami's Arati will be at 10:30. And then again we will get back at 10:45. And the rest of the session will be a group session where entirely that you learn out here, each and every one of you are going to demonstrate and you're going to learn how to do it. So it's going to be a complete hands-on interaction, the second part. So I thank all my sisters and brother. So we're going to just get started. Thank you so much. Can I expect a little cheer or round of applause, because I think Sunday morning being present here, it's such an amazing thing. I thank each and every one of you who's made your time to come here. So let's get started. So, what is BLS? It's very interesting. We'll straight away go to the tip. So as you can see, the basic life support. You're walking down the road and you see someone just collapsing. They're just collapsing. And people, this is India, so people will just guard them and they just keep looking. It's okay, you can smile, you can laugh, you want. So what we do in basic life support is we have a necessary series of steps. And with these steps, we make sure that we can save a soul. We can save a soul. Now, how beautifully Swami himself has described. Swami says, this body, he has said, the halati iti deha, which means the body is prone to be burned. But as the body is living, it experiences burning within. He has also mentioned that sadayati iti sharira, which means the body is just a lump of tissue and flesh and blood, which is bound to be decayed. He has also described the body as the mandir, where the soul or the atma is located. Then Swami has taken a slight first part is of course a physical heart. We all know it beats, and you can literally check how it beats by placing your 3 fingers right here. You know, you just here your left hand here. So it beats. The second part of the heart is called as the heart chakra, which is connected to the emotions. You know, people go through these depressions and everything, and you need holistic treatment to fix this component of the heart. The third component, as described by Swami, it's called the jyoti, or the spiritual. So there is this energy present inside the heart that sustains us. So this basic life support course, this orientation program, we're going to make sure that we can save at least one soul. Now let me give you some statistics. Here in all abroad, the population is 7 billion, out of which 15 million a year they die out of cardiac arrest or heart attack. They just die. In India, out of those people aged above 40, 47 out of 100 they die out of cardiac arrest. So today's orientation, ladies and gentlemen, we're going to make sure that at least we can throw that statistics a little down to the best of our ability. So let's get started. First we're going to go through the steps, and then we're going to see how to do it. Right. So a person is just falling down. You need not write anything, it's all given in your handouts wonderfully. You can just listen and you can appreciate the videos. It's all self-explanatory. So, the first thing when a person is falling, you don't want to be a victim yourself. So, the first thing you do is you check the scene safety. Then you check for the responsiveness. Hey, are you okay? Then, you call for the ambulance. And you ask for one more device called as the AED, which we'll discuss a little later. Then you start giving the compressions. The way you compress, and you see the movies, right? So, and then again you bring the device, the AED device, you use it, and again you start with chest compressions. So, let's just see how it is to be done. So, how was the video? It's nice, entertaining, but actually that's not what we're supposed to do. But just to give you, just a little idea on how we will be approaching the entire session. It's very important. The first 3 steps are really important. How to check for the scene safety. Now we'll be having Brother Ankur to demonstrate this thing to us. But first we're going to just go through right now exactly how do we do that, and then we'll teach you the steps.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping. Grab the AD.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds.
2, 3.
If you do not definitely feel a pulse, immediately begin CPR, starting with chest compressions. CAB sequence.
Scene safety is really important. You want to make sure that the scene is safe. Now at the end of the video, they spoke something about chest compressions. So first let's see once more, what is this chest compressions? We'll see that in detail, and then we're going to show you a live demonstration on how exactly to do that.
On any given day, you could come across a victim of cardiac arrest, where your actions and training can determine the outcome. Today we'll review the key elements of providing basic life support to adults, children, and infants. This will include both CPR skills and AED use, as well as how to help a victim who is choking, and a discussion of special considerations. High-quality CPR improves a victim's chances of survival. There are several critical elements of high-quality CPR you should remember. Start compressions within 10 seconds of recognition of cardiac arrest. Push hard, push fast. Provide compressions at a rate of at least 100 compressions per minute and at a depth of at least 2 inches or 5 centimeters for adults. Allow complete chest recoil after each compression. Minimize interruptions. Try to limit interruptions in compressions to less than 10 seconds. Give effective breaths that make the chest rise. Avoid excessive ventilation.
There's no pulse. 1, 2, 3.
CPR begins with compressions. Because compressions are so important to a victim's survival, they need to be started immediately, within 10 seconds of recognition of cardiac arrest. Early CPR keeps the oxygen and blood flowing to the heart and brain, creating valuable life-saving time until spontaneous circulation is restored.
1, 2, 3.
To be most effective, CPR should be performed as a team with rescuers completing many tasks simultaneously. However, in order to be an effective team member, you need to master the individual skills of one rescuer CPR.
Let's switch now.
For this training, we will isolate the individual skills rescuers perform and then put them together so you'll be prepared to deliver high-quality CPR and use an AED as a team.
Oh my God. Okay, scene is safe. Brother, are you okay? Brother? Okay, it's fine, don't worry. So, the fact that we came here and we checked the scene, so coming down and shouting out, okay, scene is safe, that is the first step. The second step is checking for responsiveness. So I'm tapping his shoulders with both my hands. Brother, are you okay? If the patient is responding, we'll be able to identify that, right? Next, how to check the pulse. So you see, when you extend your neck like this, you have a voice box right here. You can just feel it. You slide your fingers a few little bit towards your left or right. You see that there's one notch or one groove. In that groove, you can feel your pulse. Why do we use that pulse? Because it's the most critical pulse during cardiac arrest. I'm sure it's wonderfully written in the handout. So I'm just going to place my finger on the voice box, and then I'm just going to slide my fingers inside. I can feel his pulse. And breathing, when people breathe, their chest will tend to rise and fall. So that's how you just scan the body once and check whether the person is breathing or not. Once you confirm, you're supposed to shout out, no breathing, no pulse, someone call the ambulance, bring the AED, and then you're going to start with chest compressions. Now, of course, we want to keep brother safe because you don't want to be doing this on a live patient. So we're just going to demonstrate it on the cushions. So, brother, thank you so much. A round of applause for brother, please. So let's just go through the steps once again. You're coming to the field and you're saying, okay, the scene is safe. Then the next step, you're checking for the responsiveness. So as you can see in the presentation, so checking for the scene safety, checking for the responsiveness, and then you call for help. You tell someone to call the ambulance. What is the ambulance number? It's given there, right? 108. So someone has to call the ambulance. And then you check for the pulse. Then you check for breathing. Immediately, if there's no breathing, no pulse, you send someone to bring the AED. We're going to discuss about that later. And now brother will show us how to demonstrate. So brother, please.
So first we have to check whether the scene is safe. First we have to check whether the scene is safe. Okay. So if the person is lying in on the road, you have to make sure you get to the side. Okay. After that, we have to check for the responsiveness.
So he's checking for responsiveness, and the patient is not responding, and he's also checked the pulse and the breathing, of course, but here we're just demonstrating the compressions. So he's going to start with the compressions. He's going to shout out, I'm starting with chest compressions.
Starting with the chest compressions.
Okay, so now just 1 second, brother. Just see how he's holding the hand. You can try this out. Take your dominant hand up. Brother, just demonstrate once. Take your dominant hand up. And then the other hand, put it on top and just interlock it like this. You're going to apply force from the palm of your hand. The palm of your hand. And your hand should be absolutely straight. Your head should move 2/3. So it's supposed to be ahead. You're not putting force from the hand. You're putting force from your body, from your shoulders. So we'll see how to demonstrate, brother. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So 30 compressions you have to give, and then 2 mouth breathing. Now how to give the mouth breathing? The person will be lying down, and you will see they will just take the head. They will lift it. Brother, can you just lie down once? We'll just demonstrate it. So when the person is sitting, we hold the face. We hold with the first 2 fingers. We will be holding the mouth like this. And with the other 3 fingers, we will
jaw. So it's head, tilt, chin, lift. Head, tilt, chin, lift. And we're going to do mouth to mouth breathing. So here, since we are providing you with cushions, in the main course you will be having those body doubles or mannequins. You will be doing all that. Thank you so much, brother. We'll be doing all that, but right now you can just hold your fingers and you can breathe on your hands itself. So 30 compressions, just like brother showed, along with 2 breaths. So we'll have one more video. In that video, you're going to see all these steps on exactly how to do. I want everyone to kindly take a note on the steps and how they are giving the compressions. Because the same thing we are going to make sure that you can take away, especially in the group sessions, where we will be dividing ourselves and we will be taking a 4, 4, 5, 5 of you, and we will teach you, we'll make sure that you do these steps. So let's get into it. Thank you.
Okay, now it's time for you to practice all of the One Rescuer BLS skills together.
Hey, are you okay? Activate the emergency response, grab the AED. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
We've covered everything you need to know to recognize cardiac arrest and perform single rescuer CPR.
Demonstrated in that video. Now this process is called as a single rescuer CPR. So when you don't have any help and you still have to do it on the victim, right? So that's called single rescuer. When 2 people will be doing it, it's called double rescuer CPR. Okay? Right. So we'll just go to the next slide once. Yeah, it's all given there wonderfully. I'm sure you must have observed how he is lifting the chin, tilting the head and lifting the chin. He's using that device, it's called as a mouth prop. But in the real life scenarios, I don't think we'll be having mouth props, right? So that's why we're going to mention, we're going to use our handkerchiefs if we don't want to give direct mouth breathing. And as you can see, the BLS for adults, there's single rescuer and double rescuer. In what happens in 2 rescuer sequence, we'll watch a video later, is one person takes control of the breathing, giving the mouth breathing, the other person is taking care of the compressions. Now, let's just say just a random person is falling down. Even before you miss one step, it's going to make, so it won't look good, right? A person, you have to identify all the steps as it is given here. So let's get back to the slide before. As you can see, there's something called as the AED. Now first of all, before we get into it, I just want to ask each and every one of you, if you all have any questions or if you're a little confused with anything, you can just raise your questions. Feel free to, please don't hesitate. So we've covered up so far the scene safety. So yes, please ma'am. Okay, if the scene is a very important point. If people are crowded, you're supposed to make sure you go there and tell people, give him some space, give him some air. You want him to breathe fresh air. So you make sure that the people who are standing there, they're standing a little, wide, giving him some air to breathe. And then you go again to check for the scene safety. Like, okay, now the scene is safe. Was I able to clear your doubt? So, before we come to the AED, what are the steps I want everyone to repeat? The first thing is So the scene safety. The second one, you check for responsiveness. The third, you check for pulse and breathing. Then, okay, now in the third step it's given that you have to call for help. Now what in the video that they have done is, they have called for the device and they have called for the ambulance, whatever, at the same time. But according to the steps, you're not supposed to do that. Immediately you're supposed to call for the ambulance. Then you check for the pulse, breathing, and then you call for the AED. Then you start for the chest compressions. So it's pretty much clear right now. And then straight away we get into the AED device. So I would request Shruti and Suprita to kindly take up from here.
So guys, we have been hearing about this word called AED from the start of the whole conversation. What is this AED? Can somebody help with the uniform?
It's called automated external defibrillator. Can you guys repeat with me?
It is an automated external defibrillator.
Hello.
Guys, can you repeat with me once? Automatic external defibrillator. Okay, this is resembling to something which we see in movies and all, where you know, that thing giving shock and all that, which the Mississippi did and all that. Let's not do that. Let's know how an actual device looks like, how it functions, and what we need for that. The device, as shown in the picture, you can see it's a box-like device and it has a wire and two pads. So first what will happen is,
Open the device and switch it on. That is the first step.
okay, first and foremost, anything which starts, we have to open it. So let's open the device. Opening the device is very important because some devices get switched on itself when you open the device. If it is not getting switched on, there's a power button there which will help you to switch it on. Now let's see in detail in the video how to use it.
There's no pulse. 1, 2, 3, 4, 5,
Remember,
6,
push hard
7,
and
8,
fast.
9,
At least
10,
2 inches or
11,
5
12,
centimeters.
13, 14,
His chest
15,
needs to
16,
completely
17,
recoil
18,
after each
19,
compression.
21, 22, 23, 24, 25, 26, 27, 28.
Analyzing
Everybody clear?
heart rhythm. Do not touch the patient.
Although AEDs may differ slightly, there are 4 universal steps for operating an AED. First, turn on the AED. Open the carrying case or the top of the AED, then turn the power on. Some devices will power on automatically when you open the lid. The AED will guide you, but it's still critically important that you know these steps. Some AEDs may have adult and pediatric pads. Make sure you use the adult pads on anyone 8 years of age and older. Peel away the backing from the pads. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple. Place the other pad on the victim's upper right chest directly below the collarbone. If instructed by the AED, clear the victim and analyze the rhythm.
11, 12.
Analyzing heart rhythm. Do not touch the
Analyzing.
patient.
Let's switch.
Shock needed. Charging. Stay clear of patient. Press the flashing
Shock advised.
button
Clear.
now.
Be sure that no one is touching the victim, not even the person in charge of giving breaths. Ideally, you will pause CPR during or immediately after a set of compressions. Some AEDs will tell you to push a button to allow the AED to analyze the heart rhythm. Others will do that automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED then tells you if a shock is needed. If the AED recommends a shock, it will tell you to clear the victim and push the shock button. Again, be sure no one is touching the victim to avoid injury to rescuers. Then loudly state a clear the victim message. It can be something like, "Everybody's clear," or simply "clear." Perform a visual check to ensure that no one is in contact with the victim.
Shock advised, clear.
Press the shock button. The shock may produce a sudden contraction of the victim's muscles. As soon as the AED gives the shock, immediately resume CPR, beginning with chest compressions. Do not remove the AED or turn it off. The AED will repeat the analyze and shock cycle every 2 minutes.
No shock needed.
When the AED indicates no shock advised, you do not check the pulse first, you immediately start chest compressions again. There are also some special situations you'll need to consider when using an AED. If a victim has hair on his chest, the hair may prevent the pads from sticking. The AED may tell you to check the pads. If this happens, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, you can use this to shave the area as well, and then reapply a new set of pads. Water on the victim's chest could allow the shock to travel through the water between the pads and prevent delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. If the victim is lying on snow or in a small puddle, you may use the AED. If the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly as it doesn't have to be completely dry. Some people have implanted pacemakers and/or defibrillators in the same place where you would put the AED pads. The device will look like a round or square lump, smaller than a deck of cards. If you see this lump, try to avoid putting the pad directly over the lump. Do not place the pad directly over a medicine patch. If the shock delivery will not be delayed, take the patch off and quickly wipe the chest before you put on the pad. We've talked about the differences in compressions and breaths for children and infants, but now let's cover the difference in the use of an AED for an infant or child under 8 years of age. Some AEDs have been modified to deliver different shock doses, one shock dose for adults and one for children under 8. If you use a pediatric-capable AED, there are features that allow it to deliver the child-appropriate shock. Which feature is available depends on the type of AED you are using. If your AED includes a smaller size pad designed for children, use it. If not, use the standard pads, making sure they do not touch or overlap. The important thing is to be familiar with the AED you will be using, if possible, before you actually need to use it. When you are using an AED, remember to turn it on first and follow the prompts as it leads you through the rest of the steps. For infants, a manual defibrillator is preferred to an AED for defibrillation. If a manual defibrillator is not available, an AED equipped with a pediatric dose attenuator is preferred. If neither is available, you may use an AED without a pediatric dose attenuator.
So we've just seen how to use an AED device, as it is said. And one important thing when you use an AED, although it's not very much commonly available in our country, but it's very important that the person who is accompanying the patient, there may be somebody who's crying for the patient, make sure that person does not touch the patient when this shock is being delivered. Otherwise, we need to start another round of CPR all over again for another patient who's all there. So that is also another part of CPR and scene safety also, as you have asked previously.
I have a doubt. Do we use the same pads for small children also?
To mention it once again, for that, please do not use the same pads. Try and use a set of pediatric pads which is available for children for about age 8 and below that.
What if the pediatric pads are not available?
You can use an adult pad, but there will be something which will regulate the current that's called as pediatric attenuator. We need not get into detail about that, but that can be used to regulate and check. Now, as we finish with
Okay, thank you so much. Yeah, the last video was pretty much informative, but there is one thing that we need to be very, very careful of. The AED, we are not using it here. You will be using it in the main course right there, but just we wanted to just give you a basic idea. So here the steps are written. You open the AED, you place the pads, and the device works on its own. The one thing that we just need to make sure, this is India right again. The patient is lying and some relative or the other will just cry out, my child. And then, just touch the body. All of a sudden you press the shock. You didn't check whether it is clear or not. It is the live patient is touching the body. Patient also gets a shock. One more round of CPR we have to give to the patient as well. We don't want that. Now the next thing is, we check for the adults. And now we're going to see what exactly happens in an infant. A small little child. So, a couple of videos just that. We're just going to show you one video because the demonstration, we're mainly going to do on the adults. So these cushions and all that is available. We'll be doing it only on the adults. But just to check what exactly happens in the child. So let's just go.
You've learned BLS for adults, but what if the victim had been a child?
Hey, Daniel, are you okay?
There are important differences between BLS for children and for adults. Under the American Heart Association BLS guidelines, anyone from the age of 1 to puberty is considered a child. For these BLS guidelines, puberty is defined as chest or underarm hair on males and any breast development on females. When performing compressions on a child, use 1 or 2 hands, whichever allows you to provide deep, effective compressions. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters, allowing the chest to recoil completely. If you are unable to compress to the correct depth with 1 hand, either due to fatigue or lack of upper body strength, use 2 hands to provide ongoing high-quality compressions. For a single rescuer for victims of all ages, use a compression to ventilation ratio of 30 compressions to 2 breaths. If you are in a 2 rescuer team for children, the ratio should be 15 compressions to 2 breaths. Delivery of breaths to children requires less volume and force, but you still need to use enough air to see the chest rise. There are some differences in when to activate the emergency response system. If you did not witness the arrest and are alone, you should perform 5 cycles of CPR before you leave the child to activate the emergency response system. If the arrest is sudden and witnessed, leave the child, activate the emergency response system, get the AED or defibrillator, then return to the child. As you can see, there aren't a lot of differences between adult and child CPR, but they are important ones.
The infants and the child, you see, a couple of important points just to mention once again. Please look. Just to mention, we need to make sure that the child, first of all the steps are being followed accordingly. Just a few points that we need to start giving compressions, check the breathing within 5 to 10 seconds. Actually, you try to do it within 5 to 10 seconds, otherwise it just might get delayed. So this was just the basic introduction. We'll see one video on how to give a CPR on a child or an infant.
First, check the victim for a response and breathing. If the infant is unresponsive and not breathing or only gasping, send someone to activate the emergency response system and get the AED. Check the infant's brachial pulse. Place 2 or 3 fingers on the inside of the upper arm, between the infant's elbow and shoulder. Press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds when attempting to feel the pulse. If there is no pulse, or if the heart rate is less than 60 per minute, with signs of poor perfusion, make sure the infant has adequate oxygenation and ventilation. If he or she does, begin CPR.
This one is so far clear. I'm sure it's all self-explanatory. Now, they've spoken about
And on the other hand, we just put it on this groove. It's called the brachial pulse. You don't have to know the terminology, but you can feel the beats, right? So for children, it's much more easier to appreciate this particular pulse. Now for children, you see all the steps so far are being common, except we're not checking this, the neck pulse, we're checking the hand pulse. Even the compressions that we're going to give, the compressions will be a little different. So here, I mean, come on, small little kid, you can't put all your body strength into the kid, right? It won't, I mean, you're going to choke the kid. So we're going to get back, we're going to see how they demonstrate of the process of giving CPR to a child or an infant. So let's get to it.
Now let's look at a couple of key differences when you are performing 2 rescuer versus 1 rescuer CPR on an infant. One is a different hand placement. When you do 2 rescuer CPR, the compressor will place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. Do not press on the tip of the breastbone. The thumbs may overlap in very small infants.
1, 2.
The other key difference is in the compression to breath ratio.
9, 10.
With 2 rescuers, for the child or the infant, you will use a ratio of 15 compressions to 2 breaths.
We're not using both our hands just the way we talk it there. For children, we are just using our 2 hands. For single rescuer, okay, and for double rescuer, we're only using these 2 fingers. That's it. But you need not get into that in detail right now. We're just going to, just a very interesting this thing, our presentation so far. Another topic that is given in your handouts is called the team dynamics. You can just go through in that second part of the there's one big chart given. It's called the team dynamics. In team dynamics, that usually happens inside the hospital. So everybody is assigned a different roles and they can work accordingly. But that is just in a hospital scenario. We've given in the handouts, whatever that is given is sufficient to get you full marks in the theory exam that's going to take place in the 1-day full course. So the team dynamics, as you can see, wonderfully they have represented what are the roles given. And right now, it's so far we've just been through the video session. We are just going to recap once again. So kindly just, it will be an absolutely interactive session for a few minutes and then we'll break for the team break. So the first step, what we do, I would like to request my good brother to kindly come and just demonstrate the entire thing for us. So this is the patient line. The first thing he's going to do is going to run here and he's going to check for the scene safety.
Scene safety?
Okay, so now he's checked for the scene safety, then he's going to check for responsiveness.
Are you okay? Are you okay, brother?
He's checked for the responsiveness. He asks whether are you okay or not. Next, he's going to check for the pulse and breathing. Now the pulse and breathing, of course, in the cushion you can't. So before that, of course, you want to call for the ambulance. So you call for the ambulance, he's checking for the pulse, and then he's going to call for the AED device. He's going to shout out, please someone bring the AED. Then he starts with the chest compressions. He's going to give 30 compressions, 2 breaths. So he's starting with the compressions. 1, 2, 3, 4, 5, 6, 7, 8. You have to call out loud so that at that time you need to have that presence of mind to count. 26, 27, 28, 29, 30. And then he's going to do 2 breaths. Of course, we just bring it up the hand out here. So 2 breaths, and again he's going to just give 1 more round of CPR.
3, 4, 5, 6, 7, 8, 9,
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 more breaths. So meanwhile, by this time the AED will come and you will learn how to use, you do all these steps in the main day. Right now, after we come back from the short break, we're going to have a short recap where Shruti and Subrita will be explaining us the important points that is also given in your handouts. Okay, thank you so much, brother. They will be explaining, we'll be having one more live demonstration where me and Ankur brother will just give you a sort of a live scenario of what exactly can happen. And then once that happens, we'll break ourselves into groups and we're going to make sure that each and every one of you are doing all of these necessary steps. So I think with that we can just break this session as of now. I just want to ask if anyone has any kind of questions, you can ask us after we break. So thank you so much. You may kindly proceed down, right? For the break. Yeah. So we have some arrangements of refreshments down. There's also the washroom if anybody wants to go. So we'll meet here exactly at 10:45. Meanwhile, 10:30 will be Swami's Arati. Those of you who want to join for Arati and have Swami's Vidya Darshan, you may. Thank you so much.